single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantel Destra. This week, Governor Kathy Hochul signed legislation meant to protect the identity of physicians prescribing medications used to perform abortions. Under the law, physicians will now be able to request that the names of their practice is listed on drug labels instead of their names. The move comes as a New York physician was recently indicted for prescribing abortion medicine through telehealth to a patient in Louisiana. Many states across the country are limiting access to abortion following the Supreme Court Dobbs decision in 2022. And since then, the governor and Democratic-led legislature have made protecting reproductive freedoms a top priority. To unpack the newly signed legislation and maternal health priorities, we sat down with State Senator Samra Brouk.
Thank you so much for joining us today, Senator.
Thanks for having me. Happy to be here.
I want to start by getting your reaction to the new law that was just signed to protect New York doctors who prescribe abortion medication via telehealth. What kind of impact will this have on reproductive and maternal health care?
Yeah, absolutely. And first and foremost, I'm so grateful to the governor for acting swiftly, grateful to my colleagues for having really thoughtful legislation meant at really getting at each of these challenges as they are popping up. It can sometimes feel like whack-a-mole where, these changes are happening at a federal level and in each individual state. And here in New York, we've stood very clear in our stance on supporting reproductive freedom, supporting reproductive rights, and making sure people can be safe in administering that care, but also receiving that care. And so, unfortunately, I don't know what this legislation will do for those who have already been targeted, but certainly it is a message to other states that we are going to protect our providers, and also a message to those providers here in New York State that they will be safer just, doing their duties as physicians.
The maternal mortality crisis is impacting states around the country, especially communities of color, due to structural racism and other factors such as limited access to health care. Can you talk about the impacts we're seeing here in New York and what your biggest concerns are?
Yeah, well, I've talked a lot about the fact that the maternal mortality crisis is serious even here in New York when we have pretty decent reproductive health care, right? When you look here in New York State, Black women, for example, are 5 times more likely to die in in childbirth. When you look nationwide, it's 3 to 4 times more likely to die. What concerns me the most is that we're going to see those statistics get even worse nationwide. And when we're sitting here in New York, what we know is that we have a state legislature that's committed to saving mothers and their babies and making it safe to be pregnant and throughout pregnancy. And we also have a governor that has really been at the forefront of putting maternal health at the top of her agenda, almost every state of the state since she got into office. And so, we're going to keep looking at those things. When I think about the types of things that we can do here in New York, that even other states might be able to also do and replicate, I think of things like our doula care initiatives, right? Here in New York, we passed Medicaid coverage for doula care. That was huge because what that did was it got nearly 100,000 pregnant folks able to get that care reimbursed. Because when we think about the Medicaid births in New York State, it's nearly 100,000. So about almost 50% of births in New York State fall under Medicaid. And so I think that was a tremendous step. And you see other states who are also following suit. And what's interesting is even in some states where they are hell-bent on rolling back reproductive freedoms and reproductive rights, we've been able to find some traction with getting doula care initiated with some of individual legislators who can then, go on to fight for that. So we'll continue, working with any state that is looking for the path. We've talked to, other states like Illinois, other states like California, Rhode Island have worked on this already, and Michigan, of course. And so, New York was the 13th state to do this. I don't think we'll be the last. My hope is that others will see that it's a key piece of the puzzle when it comes to fighting the maternal mortality crisis. But at the end of the day, right now, it is going to get more and more dangerous for people to get pregnant, for people to be pregnant, and for people to give birth to their child. It's going to become more dangerous in this country. And the goal will be for New York State to be working in the opposite direction and actually continue to make it safer.
And the state has tried to reduce mortality rates through measures like incentivizing payments to hospitals and community-based providers to improve their maternal care and outcomes. Are you happy with the state's efforts so far, and could we be doing more?
Well, I want to be clear. I won't be fully happy or satisfied, with our maternal health outcomes until not one pregnant person or mother is dying, while trying to give birth. And until everyone feels safe and supported and has the tools that they need, the people that they need to have the joyful experience that everyone deserves. And so I think we've taken tremendous step forward, right? We've taken so many steps. Again, not just looking at reimbursing doulas through Medicaid, but we've introduced legislation around making sure that hospitals are hospitable to having doulas. And so there's actually a bill we have that would designate a doula-friendly workplace. And so anyone looking to give birth can choose a hospital that will allow their doula to come through and not have to face extra barriers. I've seen a number of hospitals, particularly in Monroe County, hiring on their own doulas, patient advocates to be able to support people through that process. And of course, we've also seen changes with things like taking time off for prenatal care, right? That the governor prioritized last year and that went through the budget. So there's a lot of things that need to happen if we're really going to tackle this crisis. And my hope is that when we look back in 5 years, when we look back at today and all of the data leading up to it, we are going to see that we actually have made sizable improvements in our maternal health outcomes, because unfortunately, until now, we've really been missing the mark.
And how should the legislature go about addressing barriers like the one you were just talking about related to this issue? What are the legislative priorities for maternal health this year?
That's a great question. And I love talking about maternal health and maternal mental health legislation, because at the end of the day, we're literally saving babies and mothers' lives. And there's nothing more important than that. And so, one that we've noticed, I'll go back to the doula care and the Medicaid reimbursement for that. One thing that we're hearing is that while we have tremendously grown the workforce when it comes to doulas serving the Medicaid population, we're still falling short. I talk about the fact that we're expecting nearly 100,000 births under Medicaid this year, right? And we don't have nearly the number of doulas that are accepting Medicaid right now to handle all those births. One thing that would really change that is if we actually give an equitable reimbursement rate. We fell short of that rate, which was $19.30 per birth. That's weeks and weeks of work. That's 6 times the number of hours that you're with your provider. You're actually with your doula. So it's still not enough. I pay my doula anything I could, if I could. And so, I think that increasing that reimbursement rate is going to be very, very important. Making sure that we maintain the community doula directory online so that people have that information readily available, and that we continue to look at how we're going to support folks with maternal mental health conditions. So I'm really glad the governor signed our legislation last year that would actually create rules for these depression screenings to be conducted at pediatric appointments, not just at OB appointments, because I know that I had far more pediatric appointments those first few weeks than I ever had OB appointments. So things like that, I think, are going to be important so that we can keep looking at the real roots of how we got in this crisis.
And speaking of tools to screen for postpartum depression, we're in the beginning stages of the budget process right now, and the governor put in a measure to support new mothers, which intends to distribute newborn supplies to New York moms. It includes screening tools for postpartum depression and anxiety, mental health information, self-care products, diapers, blankets, and swaddles. I'm wondering, what do you think about this measure? Do you think it'll be helpful? And are you happy with the number the governor proposed? It was about $9.5 million for these postpartum boxes and diapers.
Yeah, I think a lot of folks underestimate the literal costs associated, not just with having the birth in this country, but also the immediate cost afterward. And so anything we can do to support, again, mother and baby in those initial months up to that first year, it's the same reason we expanded Medicaid coverage up to a year postpartum, because, I think New York lawmakers understand the very unique needs that are happening during that time. So I think anything to support mothers or parents during that critical time is important. I think we also need to look at, though, what happens after that, right? And so, I've had legislation that, has these payments going to new parents to make sure that they're able to cover some of these costs, and it kind of tapers it down so that it's not kind of this big cliff that you get after all the support is gone. Hasn't everyone felt that, even if it's not monetary, when everyone's there to help you and then a few months in, everybody's gone and it's just you, right? And so it's the same way with a lot of these supports. So, I'm certainly looking for things that can be sustainable, but then also, how are we continuing to invest in that family, right? Because once you're out of diapers and, no longer needing formula, now you're paying for childcare. And we know what a stressor that is on families. I've struggled with it myself as well. And so we've got, hundreds of thousands of families that can't afford stable quality childcare. And so we've got to get to universal childcare for that. And we also need to invest in the workforce, because when I think about the person who's with my child 6 to 8 hours a day while I'm doing this work, again, I want to give them the world. I want them to, have what they need to support their family so they can show up when they're taking care of our children.
And you talked about doula care, and this has been an effort for you to expand access to doula care. Are you concerned at all about potential changes in federal cuts at the level in D.C., potentially impacting, for example, reimbursement rates for doulas and other providers?
I think we're all right to be very concerned about what effects any actions by the federal government might cause here in New York. What I know is that our commitment to these issues isn't going to change. And just because there's a new president does not mean we're going to stop serving New Yorkers and stop doing what we need to do to make sure that they're not dying in childbirth. So I am certainly not willing to go backwards when it comes to what we've achieved over the last few years. These are attacks on human life that we are seeing, especially with the whole kerfuffle with, Medicaid pausing of that spending as well. I mean, as policymakers in New York, we're looking at that and we are making the decisions that we have to make here in New York to make sure that we don't lose out on creating and delivering these life-saving services to individuals, especially when we think about pregnant folks and newborn babies.
Well, thank you again for taking the time to speak with us, Senator. Unfortunately, that's all the time we have for today. We were speaking with State Senator Samra Brouk.
Thank you so much.
And for more on maternal health, you can visit our website. That's at nynow.org. In this next segment, we sat down with Assembly Minority Leader Will Barclay to discuss affordability in the state and learn how Republicans plan to have their voices heard while serving in the minority of the legislature. Here's that conversation. Thank you so much for joining me today, Leader.
Chantel, great to be here. Thanks for having me.
I'm really looking forward to our conversation. And naturally, I wanted to start with the governor's executive budget proposal. Now, we saw in the governor's address when she unveiled that proposal, it focused largely on affordability, and it's my understanding that your conference is excited about it focusing on affordability, specifically around things like the middle class tax cuts and putting money in the state's reserves. So can you help us understand more about your conference's positioning when it comes to the governor's proposal?
Yeah, we're really very happy that she's talking about affordability. Although she's talking about a $252 billion budget, unfortunately, that's got to be paid for somehow. And unfortunately, in New York, we tax and spend a lot of money. But we are happy. We like the middle class tax cut. We like the child tax cut or tax credit. That's something that we proposed in our conference last year. Unfortunately, the majority stopped that bill. So I'm hoping they look at it in a better light and maybe pass that going forward. But we're hearing this all across New York. New Yorkers are struggling. The cost of living in New York is too high. So anything we can do to take steps to lower that cost and help all New Yorkers, I think is very positive.
And how are you planning to work with the governor and Democrats to make New York affordable this year?
Well, first, we support some of the governor's proposal. We'll work in a bipartisan way to do that. I think, as I mentioned, this is a big budget. So it's going to be a challenge. Always, when we come up with budgets, you have to set priorities. I think in the past, a lot of the priorities that the governor set and the Democrats have set haven't been really good priorities for New Yorkers. So what we often do is try to make our voices heard. I think we did with the affordability, and we try to put some pressure on the majority to make sure they don't go too crazy. I'd mention again, this budget's big, and usually when we start a budget process, the governor takes the first step, and then the legislature adds more to it. So I think last year the final budget was like $234 billion. We're increasing it to 252. You can imagine the legislature will want to put even more money in. And Chantal, I'll tell you, in the last 5 years, the budget's increased by $60 billion, That's more than something like 2/3 of all the other states' total budgets. So again, I think if there's a problem, although we're happy with some of the policies I mentioned, if there's an issue here, it's just we're spending way, way too much money in New York.
What do you make on the governor's timing on focusing on affordability? As you mentioned, this is a priority of your conference that has been the focus for some time. So what do you think is informing her decision when it comes to affordability?
Well, we're all elected officials. We all can read polls, and we all see election results. So I think Trump, who also ran on affordability, won, I think, on the basis of affordability. The governor's not naive to that, and she can read polls. And when you ask New Yorkers, they all say New York is too expensive to live in. The high cost of living here is too high. So I think she recognizes that and is trying to answer, those concerns in her way.
And going beyond affordability, are there any other policy items or agenda items within the executive budget proposal that has your conference excited?
Yeah. Well, again, in her State of State, she talked about crime. We're always happy when there's a recognition that there's an issue of crime in New York. It's something that we've been hammering on for the last several years. I think the public, too. When you poll them, affordability might be number one, crime's a close second to that. So she did raise up crime. She recognizes the problems on the subway in New York City. She recognized the discovery process that we reformed, or so-called reformed a few years ago, needs to maybe be brought back a little bit. It's gone too far and it's causing tough to do speedy trials for prosecutions. We'd like to see her go even farther. We have some issues with the so-called raise the age reform, obviously bail, we've been talking about nonstop for a long time. So I'd like to see her even go farther than maybe some of the proposals she made in her budget and State of the State to really address recidivism of crime in New York State.
And what will be your strategy to, push for the governor and the Democrats to focus on crime and get them to where you see the state should be?
Well, first, we've had success with that. I mean, we've now reformed bail reform multiple times, and I like to think we played a role, the Assembly Republicans played a role in that, because we use a bully pulpit. Obviously, we don't have the votes to change the law. We need the majority to change it. So we get on the bully pulpit. We try to get victims of these crimes to come in to tell their story, and we also try to get law enforcement prosecutors in to tell the problems that we have with the system. I would say, for instance, with bail, the problem when we instituted the first bail reform, we didn't get any input from the prosecutors. We didn't get input from law enforcement. They're the ones that on the front lines know what the issues are with these laws and are the best can advise us on how to change them to make all New Yorkers safer.
And as you mentioned, Democrats hold a supermajority in both the state Senate and the Assembly. So how are you hoping to compromise with Democrats and have your voices heard? I understand, it's out of your hands because they have all the control, but what are you hoping those conversations look like this session?
Well, first of all, I would say I've always worked in a bipartisan manner. I try to focus on policy and not personality. So I don't try to, criticize anybody for where they come from. I try to criticize them on maybe what they're pushing legislatively, and that seems to work. But where I feel very confident and why I think we can get something done on these issues in Albany this year is, again, the public is with us. Elections have consequences. Everybody can see what happened on the national level with Trump and the Republicans on a national level. So I think that adds some understanding that things cannot continue on in New York as they are, and I look forward to working with my Democratic colleagues to make the changes that we need to in New York.
And speaking on things on the national level, we saw Republicans, gain control of the White House, and they now have control over the two chambers of Congress, which is a complete 180 from how things are done here in Albany, where Republicans are the minority. So how are you feeling given, that reality right now? Are you feeling inspired by the way things are happening in Washington, D.C.?
Right. Well, it's early yet, so we'll see. But the president so far has done everything he said he was going to do when he was running for office, and he's moving very quickly. Obviously, he's still working to put his cabinet together. There's long-term issues that are going to take some time to solve, but I do like the fact that he's taking action on a lot of issues. One thing, the third number thing, affordability, crime, and the migrant crisis are probably the top three issues that New Yorkers have been concerned and are concerned about. The president's going right there, and he's looking to deport migrants that have committed serious crimes, and he's taken action on that. So I think that's a good thing, and I would encourage him to continue to do so.
And how will the president's actions inform the way that you lead Republicans here on the state level?
Again, we take everything on an issue-by-issue basis. I think our conference supports this president. I would note this president's more popular than the current governor in New York State, and we're a very blue state. So we'll continue. We'll look to work with, obviously, a president any way that we can to implement those policies that New Yorkers want here in New York.
And I wanted to switch gears and talk about congestion pricing. I know that you've been pretty vocal about your opposition to that plan that is now enacted in New York City. So I wanted to get an understanding on how you're hoping to help New Yorkers mitigate the challenges that you're saying congestion pricing is bringing to them.
Well, the congestion pricing obviously is the cost. As I mentioned the other day in a press conference, you can't talk about affordability and then charge people $9 to drive in New York City. I think it is the wrong direction. We have a problem with the MTA that runs the subways and transportation systems in New York City because they've been spending money like crazy. So first of all, we ought to get an audit of the MTA to understand what the problems are there and where the money is going. I think they can, before they start charging more for their to their ratepayers or people just driving now in the city, maybe they want to look at trying to collect the money from the fare beaters or people that jump the turnstile. Maybe they want to look at other things that they can do to run a much more efficient operation than what they're currently doing. We can't just keep charging people more and more money because the prices are going up. People can't afford to do that anymore.
And in response to your opposition to congestion pricing, the governor said that upstate elected officials need to understand that the residents of New York City need help. Congestion pricing will bring help, and it would also support revenue going to the MTA. And she also invited you to take a trip on the subway. So I wanted to get your response to that position by the governor and understand if you've had any conversations with her about taking that trip on the subway.
I haven't, but I'm willing to take that trip with her, provided she's willing to take a car trip with me from the hardworking firemen, policemen that might live slightly outside the city and have to commute into the city, or the hardworking New Yorkers that live maybe on 61st Street and have to go to work downtown. That's going to cost them $9 every time they try to cross the block. So, but I am very happy to have any of that conversation. I may be from Oswego County. I know congestion pricing might not directly affect me, but I also represent a conference of 47 members. We have members in the city. We have members in all the MTA areas around the city and the suburbs, and that is directly affecting them. And they're the ones telling me that their constituency cannot afford to pay the $9.
And what are some of the other priorities of your conference beyond affordability, beyond crime and the migrant crisis and congestion pricing? What else are you going to be focused on this session?
Well, the thing that we always feel strongly about is the out-migration of people. We've lost a couple 100,000 people in the last few years. Over 10 years, we've lost more than 1 million people in New York. So why are these people leaving? Certainly the affordability, I think, is a big part. The governor points to housing being a big issue, which we happen to agree with. We might not agree with what she thinks is a solution, which is more government control into housing, more government input into housing. What we would like to see is getting government out and getting developers to start building houses so they can do it without the huge risks that in order to do it now because of all the government mandates and whatnot put onto building housing, we think would be better. I do agree with the governor this far. We got to increase the share of housing in New York, and so as we increase the supply, that's going to be able to lower the demand.
And lastly, what would make for a successful legislative session for Republicans when, things are all settled in June?
Well, first of all, we don't think the sustainability of the budget. As I said, her proposal's big. Very likely legislature could put more money in. We'd like to see a more realistic budget number that we can afford going forward. With her current proposal, we have some huge year gaps or big deficits going forward. So we may get away with it this year. The following year, the year after that, it's going to really cause us problems. So we'd love to see a more sustainable budget. Taxes continue to be a huge issue in New York. We tax everything in New York. Health insurance, we tax property taxes, sales tax, you name it, we tax everything. We have to get more control of that. I think the middle class tax cut is a good first step. I think the child tax credit is a good first step, but there's a lot more that we could do in fiscal policy, I think, to make New York more affordable.
It sounds like there's certainly a lot to look forward to, but unfortunately, that's all the time we have for today. Thank you so much for taking the time to speak with us today, Leader.
Thank you.
And we were speaking with Assembly Minority Leader Will Barclay. And for more on the Republican priorities this session, you can visit our website at nynow.org. Next week, we'll be sitting down with State Senate Majority Leader Andrea Stewart-Cousins for a broad-ranging interview. You won't want to miss it. Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,